Mr. President, I rise to discuss the impact that Obamacare is already having on constituents, likewise, as my colleague said, in my home state of Georgia. One of my constituents, Jeannie, from Twin City, Georgia, is a registered nurse at a small hospital. Her husband's a retired Navy officer who served this country honorably for 20 years. They're on TRICARE, so Jeannie didn't need her employer to pay for her health care. However, because of Obamacare, Jeannie's employer is cutting her hours to less than 30 hours a week, which means a drastic pay cut for her and her family. I fear this health care law will continue to force employers to reduce employee hours in order to avoid the unaffordable health care cost. Another constituent, Thomas from Columbus, told me about the problem he's facing with his son. His son graduated from college, but like so many his age, has been unable to find a job in this tough economy. His son works hard to make ends meet and was lucky to find a bartending position that would allow him to work full-time. Service industry professionals normally, as in the case of Thomas's son, receive benefits. So Thomas bought his son a catastrophic insurance plan that they could afford. Now it looks certain that this plan is not going to be acceptable under Obamacare. So his son will not qualify for Medicaid, but will not be able to afford the premiums that he will now have to pay for this catastrophic policy. Our economy is still recovering and Americans are still struggling. Thomas and Jeannie are exactly the type of hardworking Americans that health care reform should be making life easier for and not harder. It's time for the President and Democrats to join us in scrapping this law and starting anew. Mr. President, I yield the floor.